Okay, Dr. Kenneth Hughes here in Los Angeles, just a Harvard-trained board-certified plastic surgeon, giving you his opinion on how to select your plastic surgeon. Okay, there are, in the larger metropolitan areas, New York, California, it can be exceedingly difficult. Even in smaller areas, it can be difficult. I think with the advent of the web and that being so much a very integral part of a lot of people's lives with regard to every aspect of life, searching for food, searching for clothing, searching for doctors, searching for basically everything they could possibly need in life. You are going to have people who are searching for plastic surgeons, not just in the area, but outside the area, other states in the U.S., outside of the U.S. So I think these are things that patients should keep in mind. So first, I would say that board certification by American Board of Plastic Surgery, you can look that up on the ABPLS website, is an important factor. It may be the thing that helps patients stay away from maybe potentially less desirable options, okay? So, but it's certainly not perfect. For instance, I know some very, very good surgeons who aren't board certified for one reason or another, and I certainly don't hold that against them or think that because surgeon A is board certified that surgeon is a better technically or is a greater intellect or anything like that. So it's important that the surgeon have the requisite 6, 7, however many years. The residencies are a little bit different, but for that plastic surgery residency in the U.S., that's about how long it takes. And so if a person has that training, you are going to probably be in very good hands. Now, the reason I mention that is you can certainly do these procedures without plastic surgery training, as odd as that sounds. There aren't regulations on what type of surgeon you have to be to perform these procedures. So you could be ear, nose, and throat. You could be ER physician, OBGYN, family practice. They can perform breast all, liposuction, any of those things. So at least inquire as to the educational background of the surgeon. So I think that's important. And if they're board certified by the American Board of Plastic Surgery, I think that's great as well. Now, beyond that, you need to be checking websites for photos, videos, things of that nature, things that can help you decide who will give you the best probability chance of success. So let's take liposuction. Let's say you have a surgeon who has 3 pictures on the website or no pictures, and another surgeon who maybe has hundreds of before and afters. Well, you're probably going to be more comfortable with the surgeon who has hundreds of before and after. So you know that this person has repeated the process hundreds and hundreds of times, which is important for your success. Not only that, has worked on many different types of anatomies and generated good results despite some of the people's less than optimal anatomy, okay? Plastic surgery is a lot less about what you can do on an ideal patient and what you can do across a broad spectrum of patients, okay? So for myself, I do a lot of revision surgeries of every type: revision, liposuction, revision, rhinoplasty, revision, tummy tuck, body lifts, thigh lifts, some of these surgeries that maybe aren't as common, like fat necrosis removal. So I'm doing a lot of things maybe that aren't in the repertoire of other plastic surgeons. Once again, that's not to state that I'm better. It's simply to state that different surgeons do different procedures and like to do different procedures for whatever reason. So let's go back to liposuction. Let's say that you're looking at liposuction and you want to make sure that you don't end up with dense divots, irregularities. Well, look at the before and after pictures. Look at the videos. Look at pictures of the abdomen. The abdomen, it tends to be the least forgiving component. If the abdomen has any signs of that, then you probably want to find another surgeon. That's totally up to you. I mean, I think the best result from liposuction is a dramatic result wherein you can't tell the patient had surgery, okay? So in other words, the smoothness is there as it was before surgery. It's just that the patient looks much better because you've removed the subcutaneous fat and you've removed it in a uniform fashion and evenly. So that's important. And I think if you use the videos and the photos, that helps you tremendously. Now, certain people get referrals. I think that's fine. Just go in with the understanding that that person's body, face, nose, breasts, rest of the body, they are not identical to yours. You don't have the same genetics. Therefore, you won't have the same healing, you won't have the same starting anatomy or ending anatomy. So just realize that that's not a guarantee that you're going to look like someone else, okay? Because there's one thing for certain, you won't look like someone else. That's a guarantee. So, you know, education, certification, before and after photos, videos, referrals, all of those things are important. In addition, you know, some patients will look to other states outside of the country. A few comments about that. Some people really do search exclusively for price, or almost exclusively for price. My feeling on that is, you know, find the surgeon who can give you the highest probability of success, and then save to have that surgeon perform the surgery, okay? If there are two that you truly feel have equal skill level, and one's cheaper, of course it's fine to go with the cheaper surgeon. That's just like anything else. You know, you're making decisions in a very logical manner, okay? So I wouldn't begrudge someone else, a patient coming in and telling me, hey, Dr. Hughes, this is just too expensive, or, you know, this other guy does the same work for less. And if they really believe that, then you shouldn't have hard feelings about the patient going somewhere else, okay? By the same token, you know, there are people who will charge more and maybe don't generate the results than I can, okay? Or, you know, that the patient thinks. So let's the patient comes in and they say, there's another guy who charges whatever. How come you don't charge that much? So it goes both ways. Patients sometimes think that there's something wrong with either what you're charging is too high or too low. I do it in a very reasonable fashion. I just basically calculate it based upon time in the OR, how much time it's going to take, and then across the procedures, that's kind of how the surgeries kind of dictate their own prices, okay, based upon time in the OR. Now, some patients are much more difficult than others. Some patients have a lot more skin. You just know that certain surgeries are going to take longer, and that's fine too. So I put all the prices and costs and everything on the website so that I'm not trying to deceive anyone. It's right there for you. And I think, you know, having it transparent like that avoids some of the confusion later. But take home point, don't select it exclusively. Don't select your surgeon exclusively based upon price, okay? If you can find the surgeon who can perform your work to your satisfaction in your own backyard, that's great too. I mean, obviously stay in your own backyard. You want to be there as close to the surgeon and whatnot. If you feel that you can't get that, then, you know, traveling will be an option. Many plastic surgeons get patients from other states and countries, and that's great. Most of my patients aren't from LA. They're from other areas of the country or other countries. And so I, you know, am comfortable dealing with those scenarios as well. So I think if you keep all of those things in mind, I think that kind of gives you a good logical progression of how to formulate your opinion of, you know, who's the best surgeon for me, okay? I will hopefully next time come up with a more inspiring topic, but I think this one needs to be done just because I get this question a lot, and I think that it kind of grates on some people as far as like, how do I make this decision? How do, you know, which one should I pick? You know, I've had quite a few surgeries in my day, not cosmetic, but nonetheless, when I was searching, I was trying to find the best surgeon, okay? And I wasn't basing it on office staff or any of these other things. I was purely trying to get the best surgeon. And I think there are a great number of tools available to people searching for plastic surgeons, whereas good luck finding information about orthopedic surgeons or cardiac surgeons or things of that nature, because in the past that was almost impossible to identify those things. So I think that's another thing that really helps plastic surgery patients, is you have just a vast array to explore. Not that you should explore everything, you will drive yourself nuts, but you at the end of the day will know infinitely more about your plastic surgeon than your plastic surgeon will know about you. So take some comfort in that. All right, have a good day.